I want you to picture a rural health clinic, say in my home country of Kenya. Now imagine a young girl, maybe 15 years in age, in the middle of a long queue outside the family planning room. She's surrounded by older women, most of them mothers. She's extremely nervous and looks out of place. When her turn comes, the provider tells her to go back to the end of the line and allow mothers to be served first. Those are more important, the provider says. By the time the young girl's time comes up again, clinic hours are over. Provider says, you could come back another day, remarking, after all, you should be focused on schoolwork, not boys. See, that young girl is not alone. Far from it. Today, 23 million adolescents in developing countries have an unmet need for contraception. And that is the problem. Not just because access to contraception should be a basic human right, but because depriving young people of it could lead to serious consequences. Unplanned pregnancies, unsafe birthing conditions, and undue hardship to women and their communities. And while we can and should be advocating for better policies and more resources, our providers' personal bias can thwart our best efforts. That's why my organization, Pathfinder International, in collaboration with our partners, WILUPS, Kemba Collective, and RAND, initiated the Beyond Bias project. We aim to understand what really goes wrong during those crucial moments of interaction between a patient and a provider, and what we can do about it. We work in Tanzania, Burkina Faso, and Pakistan. And in each country, we see similar stories. Some providers are morally opposed to offering contraception to an unmarried adolescent. Others don't provide contraception to any young person who has not yet had a child. Still others believe that withholding contraception is within the patient's best interests because they may think that it will decrease their likelihood of being sexually active and maybe contracting a sexually transmitted disease. So these biases are not new. In fact, many health workers go through trainings on providing better, more youth-friendly services. They make honest commitments to change. Yet, so often, the needs of young people still go unmet. You may ask why. It's because, as we've heard today, bias is a complex human condition, and it has so deep roots, extremely deep, to be addressed by training and supervision alone. That's why Beyond Bias takes a comprehensive behavior change strategy. We humanize bias. We build empathy, give social affirmation, and provide concrete support and social rewards that can change behavior. We begin by hosting a story-driven event, empathy-building event, where young people share firsthand with providers their experiences with denied care and the consequences they've suffered as a result. From there, we take providers through a journey of self-reflection, helping them develop self-awareness of their own biases. We give them a safe space where they can engage one another openly and without judgment, affirming that we all struggle with bias. Then we connect providers with each other so they can continue to build support networks. And finally, we implement a rigorous data analysis and reward progress through public certifications and letters of affirmation that could elevate a provider's practice. In short, Beyond Bias works with providers so that they can truly provide to every young person who seeks help in planning their future. This work has been gratifying on a professional level and a personal one. See, I grew up in a community in Kenya where, women's sexual health and sexuality in general was a very hush-hush topic. I saw many women's lives devastated but a lack of access to care. I saw my own mother, though untrained, striving to provide care to women who had no other option and no access to care. So when I look at the young people we serve, I see myself. I know I could have been that girl. I could have been that young girl sent to the back of the queue at the health facility. And though our work is still in the early stages, what inspires me is that we've begun to see signs of positive change. And I firmly believe that we even can have more massive change. Just watch.
Elle est venue pour prendre une méthode contraceptive parce qu'elle a un petit copain. Elle m'a mis hors de moi-même, donc moi je l'ai tout de suite sachée. Mais vu là, je me suis dit qu'à cet âge-là, elle ne devait pas avoir un petit copain. Mais 3 mois après, elle est revenue me voir parce qu'elle était enceinte. Je me suis culpabilisée. Elle est enceinte à cause de moi.
मेरी हर रोज़ अपने बाइक्स के साथ एक जंग है और मैं अपने क्लाइंट को ये कह देती थी कि मैं तुम्हें लॉन्ग टर्म मेथड नहीं दूंगी। तो ये सब करने से, क्योंकि मेरे अंदर ये बात थी कि कहीं ये गुनाह का काम है या इस पे जो है लोग मुझे क्या कहेंगे, मेरे बारे में किस तरह की राय कायम कर लेंगे।
Kulikuwa na story ambayo mimi ilinigusa sana ya binti mwenye miaka 18 ambaye kwa kukosa tu huduma ya uzazi wa mpango ilimpelekea kuwa na watoto wawili. Kwa hiyo hicho mimi kilinigusa sana na kikanifanya kwamba niweze kuona kwamba nina umuhimu wa kutoa huduma ya uzazi wa mpango kwa vijana bila kuwabagua.
Ce colloque a vraiment changé beaucoup de choses dans ma vie quotidienne. Après avoir écouté les différents partages d'expériences personnelles, j'ai vu vraiment que j'ai vraiment changé.
As a healthcare provider, मेरे बायसेस मेरे मिशन के रास्ते में एक बैरियर की तरह थे। मुझे अपने बायसेस को समझने के लिए अपने अंदर झांकने की ज़रूरत है ताकि मैं ये समझ सकूं कि मेरे बायसेस का दूसरों की ज़िंदगी पर किस तरह से असर हो रहा है। ज़बरदस्त, इसके लिए तो फिर क्लैप होनी चाहिए भाई।